Many people who develop cancer will have relatives, friends, neighbors, colleagues tell them about an alternative or complementary therapy that is purportedly much more effective than standard therapies and that they claim could cure their advanced metastatic cancer. The internet and magazines are also overflowing with stories about such complementary and alternative therapies. In this video, I will discuss why these are considered alternative and complementary rather than standard therapies. My name is Dr. David Stewart. I'm a medical oncologist in Ottawa, Canada, and professor of medicine at the University of Ottawa. And I recently wrote a book on cancer called A Short Primer on Why Cancer Still Sucks that can be purchased online through Amazon Books if you're interested. This is the 9th out of 16 videos that I'm putting together on different things that people often ask me about cancer. And for additional information, you can see my book. Importantly, for your own personal health care, very important that you seek the advice of your healthcare advisors. An experimental therapy is a non-standard therapy that is new, that is being investigated to see whether or not it might be of benefit. At this point, we just don't know, but it is undergoing testing to determine whether it is beneficial and effective or not. On the other hand, an alternative therapy is a non-standard therapy that is used instead of a standard therapy. And it's the one that for which there is just insufficient information to know whether it might be of any benefit or not. And in some cases, there's substantial evidence that it is not of benefit, but there are still claims of benefit, and it is used instead of standard treatments. A complementary therapy is a non-standard therapy that is used in addition to standard treatments. And again, there's just not sufficient information to say that it is of any benefit or not. And in many cases, there may be evidence that it is not of very much benefit. For simplicity in the rest of this video, I will use the term alternative therapy to refer to both alternative and complementary therapies. With these alternative therapies, claims are made that they are beneficial despite the absence of data to actually prove or confirm that they are beneficial. We do not necessarily know for sure that an alternative or complementary therapy would not work because, again, there just may not be enough information. It's just that the claims are excessive. And we know that for at least some of them, there's always a possibility that it could be beneficial because many of these come from plant products. And we do tell people that to eat lots of fresh fruits and vegetables because there is evidence that eating fruits and vegetables is good for your health. So it does remain possible that some of these things derived from plants may also eventually be found to be helpful as well. In addition, plant products have been used for thousands of years as treatments for different remedies. So we do know that sometimes things derived from plants can have medicinal properties. And in fact, some of our standard chemotherapy drugs were derived from plants. So drugs like etoposide and vinorelbine and docetaxel and paclitaxel, these were all derived from plant products. So if somebody claims that a plant, some kind of plant that's an alternative therapy is beneficial, we may not be able to say with certainty that it is not, because there is at least some possibility that under some circumstances, some of them could be. And also we do know that plant products are of value for other things. So we know, for example, that marijuana and its derivative CBD oil does help some people with nausea and also can help some people with pain. We know that plants that are rich in fiber can help with constipation. We know that plants can be beneficial for a variety of purposes. So again, any alternative therapy that's derived from a plant product, it does remain possible that in the future we will find that they're beneficial. It's just that at this point in time, the claims that are made about their benefit are not supported by the amount of evidence that we have. In addition, again, we know that eating a diet that's rich in fruits and vegetables is good for your health. So some people have claimed in the past that this might be due to the antioxidants, and so that taking an increased dose of antioxidants like selenium and vitamins A and C and E could be beneficial. That they could actually help reduce the risk of developing cancer or with help with the treatment of established cancers. However, when we've actually studied this is not what we have found. So there are now different studies of antioxidants that have shown either that they do not do anything to reduce the risk of developing cancer, or that they may actually be associated with an increased risk of developing cancer. And there's some evidence that they actually may help protect tumor cells, help them survive and grow. We also know that antioxidants may directly antagonize the effect of chemotherapy and radiotherapy, so it may not be a good idea to take them at the same time that one is taking treatment for a cancer with chemotherapy or radiotherapy. Other alternative approaches, some people have claimed that eliminating sugar from the diet will be effective in fighting cancer. And we do know that eating too many calories increases the risk of getting cancer. And we do know that cancers use more sugar or glucose than normal tissues do. But as I've discussed in an earlier video, eliminating sugar from the diet will not make a big difference because the cancer produces other things that lead to the breakdown of muscle in your body to produce all the sugar that the cancer actually needs. So eliminating sugar from the diet would not be expected to have any meaningful impact on treatment of a cancer. So we do hear a number of people say that they've been helped a lot by alternative therapies. So what's behind these stories? Well, in my own personal experience, when I've talked to patients that have claimed they've been helped with alternative therapies, I found two major patterns. One is that the alternative therapy was taken along with an effective standard therapy, and the other is that the patient may not have had cancer at all. So, for example, there was a man who came to our condo to do some work on it, and he told my wife that he had cured himself of an advanced aggressive cancer by alternative therapy. When I talked to him, I asked him some very specific questions, and he did have cancer, but it's one that is usually cured by radiotherapy. There's a very high cure rate with radiotherapy, and he did receive high-dose radiotherapy. But he told everybody who had listened to him that he had taken an alternative therapy and had cured himself with that. He did not tell them they had also had effective radiotherapy at the same time. In another situation, I was talking to a woman at a party who told me that she had an advanced aggressive cancer and she cured herself with alternative therapy. When I asked her what kind of cancer she had, she said she wasn't really certain. I asked her what the biopsy showed, and she said, well, she hadn't really had a biopsy. I asked her what the scan showed, and she said she hadn't had any scans. All she knew was that she didn't feel well, so she must have an advanced cancer. So she took an alternative therapy, felt better, and therefore knew for sure that she had cured herself in advanced cancer using alternative therapy, when in fact the probability was that she never had cancer at all. And the situation has been similar to other patients that I've talked to who have claimed that they've had marked benefit from an alternative therapy. So again, can never say for sure that it cannot be a benefit. It's just that there's problems with the way that some of the claims are made. Also, in many cases, alternative therapies are unlikely to be harmful, although sometimes they can be. For example, I've seen patients with potentially curable cancers who have decided not to take the standard therapy that could cure them, and instead have taken alternative therapies and have died despite the alternative therapy. And they might have been cured if they had taken the standard treatment. I've also seen patients who have been lied to by others who are taking advantage of them. For example, one of my lung cancer patients, her marijuana dealer told her that if she just bought enough marijuana from him and took enough marijuana, that he could cure her lung cancer. So she was buying $800 worth of marijuana per week as she was steadily deteriorating. So in some cases, there is direct fraud associated with sale of these alternative therapies. So when one of my patients asks me about alternative therapies, I tell them it's an alternative therapy because there's not enough proof to support its use. And that I think that most of them will end up not being useful, but I cannot say for sure that none of them would be. I tell my patients that I generally have no problem if they want to take an alternative therapy, as long as they understand that I do not think it's likely to work. I do not advocate it. I will not prescribe it. But if they want to take it, then that's usually okay from my perspective. I do advise them against taking high doses of antioxidants at the same time as chemotherapy or radiotherapy because it might antagonize them. But most other things, there's a low probability of major problems from it, although occasionally they can cause major complications, but usually they do not. I also tell some of my patients that if they're taking alternative therapy that is a plant product, that it might not be a bad idea if they talk to an experienced naturopath who can guide them on what some of the toxicities might be with that plant product. So again, an alternative or complementary therapy is one that there's just no proof that it's of any benefit. If proof emerged, then we would gladly tell patients to do it, just like we tell patients to eat diets that are rich in fruits and vegetables, just like we tell patients to get lots of exercise. If something works, then we would gladly recommend to patients that they do it. But we do not recommend alternative therapies because there's not sufficient evidence to indicate that it really is of any benefit. On this and other aspects of cancer in general and alternative therapies, again, you can see my book, A Short Primer on Why Cancer Still Sucks, that can be purchased online through Amazon Books if you are interested. I hope that you found this video helpful. Thank you.